call that our M.P.R. FM radio, and it's like a radio transmission. We can talk together, and then we will wait, no problem, for 2-3 minutes for the other coming. And as you see, our M.P.R. philosophy is all around the world, and the school is all around the world. We have schools in America, we have schools in Europe, and we are trying to open now in Middle East with you the develop of this school. That is a very wonderful school. Why? Because we make a very good protocol for all medical science. Today, we are most physiotherapists, but as you know, M.P.R. is for everybody, it's for all medical science. As you will see now in the presentation, because this presentation is just to explain to people what is the basic of M.P.R. And then at the beginning, I will explain all of them also, how we are organized in our school with the different courses, because as you know, all around the world we have different courses that the people can choose to develop themselves. And then I will explain that in the conversation today, how they are the courses, how they are the formation, and also the main thing, what is M.P.R.
Dr. Rocca, sorry to interrupt you. I would like, until some other people will join us, I would like you to introduce yourself first to all of us. And also, we will like to hear from those who are here with us. We will hear from them as well, where from they are and their introduction. And then we will start up the things. First, please, if you introduce yourself to us, like all the things.
Okay, I am Professor Dr. Silverio di Rocca. I am we say the father of M.P.R. I am a medical dentist, and I start many years ago when I understood that the body is connected all. I start to develop this protocol. That means 38 years ago. I have 45 years profession, and I teach all around the world. I am an expert in posturology. I am a specialist in my field, in one field that is craniofacial orthopedics. And then I go to specialize myself in posturology and in posture, treatment of the posture. And then that was in France many years ago. That was in 1982. 1985. And in that moment, when I discovered the connection with the whole body, I said to myself and to my teachers, if this is true, if this concept is true, we cannot work anymore, because dentists cannot treat in a day the body, and physiotherapists, if they cannot do a good rehabilitation, if the craniofacial system is disturbing, and I cannot do a good treatment like a dentist, if physiotherapists don't do a good job, it's time to stop. I said that in 1985. And in that moment, it's coming through my mind. I think God say you have to do that. Yeah? It's a very good, very hard job was for me. And in that moment, I start to think in a protocol. I have my preparation in different parts of the world. I studied in America, I studied in Europe, I worked in different parts of the world. Now I live in Switzerland, and I am the director of this school, who is a virtual school for the theory and a practice school in different places all around the world. all around the world. That means in South America, Central America, North America, West Europe, East Europe, and now I want to introduce that in Middle East. That is my presentation, little presentation. I have a CV, it's longer to explain just in 5 minutes, but that is what I am. I am the director of all the school. I have teachers all around the world. We have teachers all around the world. We have osteopaths, teachers, physiotherapists, teachers, medical teachers, dentist teachers all around the world that they teach with me in different parts of our world. Our world you will see now, I will put a little video just to show what is our world when we finish to this introduction, a little panorama of what is, and I think in the meantime we talking. I won't put the video starting, and then you will let me put the audio of the video down, yes, and then as you see here. You are seeing now the world of M.P.R. This is our world. This is our world all around the globe. We have schools in different parts, and then we are trying to introduce in Middle East our school. The main objective of the school is just to teach the same language of all medical sciences. And then we do formation for each medical science. We do formations for doctors, for dentists, for physiotherapists, separated. We do a basic formation just to understand what is M.P.R. Because if you don't understand what is M.P.R, you cannot be formatted with our techniques. And then we do masters we call the master for you, your physiotherapists. Our masters are masters in, we call that manual therapies of M.P.R. And is the different things we use, to treat our patients in neuromuscular rehabilitation. As you see, this is a little picture of us, of our school. No, this is pictures all around the world. I take a little part of them. No, this is me teaching in Chicago. This was a Chicago meeting. No, this was in United States also a meeting with physios in different parts of the world. We had this was in Italy. And this is our fantastic. I call that our fantastic world of M.P.R. No, and this school. Was created many years ago. At the beginning, as you know, the technology was not helping us, and all the courses was presential. But that was a very big work to do that. And then for just around 9 years, when technology started to develop, I create this virtual room. This virtual room is the room we use for the theory, and then after the theory, we concentrate on the practice in place. And why? Why is that? Because at the beginning, when we started to do theory and then just finish the theory, the practice, people.
One second, Dr. De Rocca. There's a message in the chat room that they can't hear the audio. Is there any problem with them?
Which one is? Let me see. They have to enter in audio conference. Which one is? There is only one. I will try to see if they can.
That's why I was thinking that we will tell them to introduce themselves so that.
There is only one who is not. Let me do a message. Let me do a message that. Let me write to him a message, and that they have to enter. You have to enter in the audio. You can. I will write to him. Okay. You have to enter in the audio conference. Okay, this is only
Yes.
one. No, you cannot interact now. At the end is one of them that they want to interact.
And
At
also,
the end, at the end you can open. I will open the micro for the people who. I will try. I will try the microphone for the others. Okay.
yeah, that's why I was thinking that
Okay.
we will just ask them the introduction.
Yeah. Yes. Tell me.
We will ask them to give their introduction so that we can start up the things.
Yes, yes, yes. If you like, I think it's better we start because it's only one who don't listen. The other people listen to us, but they think
Okay.
they cannot interact. At the end, or normally when do the lectures, at the end of the lectures, I stop and then I open to people who want to talk with me. Okay, there is an
Yeah,
option.
surely,
There is an
surely.
option in the meeting room. There is an option, and you can click on there, and you can put your hand up, and then we can talk with you. We can open the audio, and then we can do question, and I answer to you directly. But then we will do that at the end because if it's not, it will be very a little conference now. What do you think? Yeah.
Yeah, we can start up.
Okay.
Orlando is
Okay.
also there. Orlando is also there.
Yes, yes, Orlando is here. Yes, yes,
Yeah,
Orlando is here. Yes, yes, is here. Yeah, and then I will start the conference now. Yeah, and then
yeah.
after that we will talk together. We can interact. You can do questions, etc., etc.
Yeah, please,
Okay.
you can start up the things. Thank you
Okay.
very much.
Okay. 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 Now I want to start the lectures. The lectures. This is our school. And we said in our school, good posture is when we have a balance in the body. And you will understand why. At the end of the meeting, you will understand why I said that. We said the stomatognatic system, that means craniofacial system, in balance with the postural tonic system. This is an important question at the beginning, and you will understand later why I said that. This phrase was anonymous, and it's very, very nice. And I put everywhere in each language this. A mind is like a parachute. It doesn't work if it's not open. And all people who want to understand M.P.R, they have to have the mind open. First thing. The second one is a phrase for Maslow. Maslow was a psychologist. And he said many, many years ago, he said that if all you have is a hammer, everything looks like a nail. Why I put that? Just to said that normally we see our patients through the eyes of our speciality. That means our hammer. And another phrase that I also love is this guy was living in the 80s, was a philosopher, Argentinian philosopher, and he said, I will change my mind every time I will discover new things. When my brain will not be capable of doing this, I will stop the work. And I add to this, this is not age. That can be happening at 5 years old, like at 100 years old. And this guy, who is Stephen Covey, said paradigms are powerful because they create the lens through which we see the world. And when I invent M.P.R, I will. I was creating a paradigm. Which paradigm? Which paradigm we are talking? I want to create to change the diagnosis objective. Take it from local to global. That's very good, very hard job. From sectorial to integral, and make it interdisciplinary. Speaking the same diagnosis and therapeutic languages. We cannot understand each other if we don't speak the same language. The courses we are doing, and I do a little introduction to you all. We study clinical posturology, we study clinical posturometry, we study nutrition and biochemistry, we study TMJs and neuromuscular diagnosis, we study the functional dental occlusion, we study how to deprogramming and reprogramming. You will see later what they mean, and we do general revision, clinical study cases, and then practical workshops. The structure is like now, live online classes in your home, quiet and relaxing. The theory. This theory will be recording, and you will have the recorder for revision of the cases. We will send to our student PDF, whether we share them in a Dropbox, and we do later masters. We do master for dentists in orthopedics and orthodontics, implant and prosthetic rehabilitation just for dentists. We do master for manual therapists, for physiotherapists. We do for technicians, laboratory technique courses. We do integrative medicine for doctors and specific mini courses. This is our school. We do in this school's exams after each class, multiple choice, and at the end, a case presentation examination enable to obtain the certification. We have a certification for the Y University. I want to say for all of you one question. Who has not had a therapeutic failure in this professional life, in his professional life? Please raise your hand. And if we are in front all together, I don't know if everybody raise your hand, but the answer is very easy at this question. Everybody working specialists have a failure, a failure. Do we ask ourselves why? Why we have these relapses? Look at that. This is a dentist. The dentist, when they have a problem, they repair the trauma here. But we normally don't ask ourselves why it happened. Even if I am an orthodontist, protect against the relapses. But do we ask ourselves why we have the relapses? If you are a rehabilitation therapist, we do techniques, different techniques, but if the techniques, it doesn't work, what we ask ourselves why. Imagine we can have a Ferrari, yes, we are very rich, and we can have a Ferrari, and we bring the Ferrari to a mechanic, and then we said, Okay, repair my Ferrari, put in good balance, and then we're coming back with the wheel like this, in this problem, with this problem. And then we go back to the mechanics. No? And we ask to him, hello, sir, listen, what happened here? And he answered to us the question like this: what type of tires did we use? And then we say Goodyear. And he answered, okay, let's change to Firestone. And if any time that happened, it repeat the same, I think we surely we don't came back to this mechanic. When we change techniques that do not work, we act in the same way of the mechanic. And I will tell you why is this. We have to ask why first, then when, and then how. Why is diagnosis? When is the priority that I have to treat? And how is technique? Technique is the last. The first thing is make point to why happened and when I will start, and then which technique I have to use. Any part of the medical sciences is the same. And then I will tell you what is M.P.R. M.P.R. is connection between craniofacial system and the rest of the body. This is M.P.R. We cannot treat craniofacial system without have a good balance in the body, and you, therapists, you cannot treat the body without have a good balance in the craniofacial system, because each one will interfere with the other therapy. M.P.R. is a diagnostic and therapeutic method that uses different tools from different disciplines. The objective of the M.P.R. is to diagnosis and make a point to the priority we have to take. And this is the key: integration. Integration, neurophysiology integration of all the systems. When we do an action in one part of the body, we will have a reaction in the other part of the body. And that's why we have to integrate our therapies. Integration, the key. Any technique that can release this in a traumatic manner, welcome to M.P.R. Integration. What means integration? This is the key word. We cannot do anything alone or using a single tool or with a single specialty. It is impossible. This happens when the same language is spoken among all disciplines. We can do integration. If you physios understand the craniofacial system, and the people who treat craniofacial system understand your job and medical job and production job and etc. Everyone has to know what is the other field. And we're talking about point of view. Who has the right here? Both. Both have the right. They can fight the whole life fighting because they are looking at number in their point of view. And we do that seeing through the lens of our own speciality, and this is very wrong. I cannot see the whole body through the lens of my speciality, because that is wrong. That is the key of M.P.R. Create a medical networks all around the world with people with the same mentality, with the same philosophy, and with the same techniques working together. We create networks that work with the same optics all over the world. You will be part of this. You will be formatted in M.P.R. This lady that we can call any name, we said Madame Rose, but it's a common patient all around the world. Patients who have pain and is going all around the world through the different specialists. Yeah? And then at the end of all visits, we have this patient who coming back with the same pain, and the specialist, they said, from my point of view, yeah, she is good. She is good. She has no problem. And the patient coming back with the same pain. Why happened that? Yeah? This figure, these things we see all around the world, the same. Patients who have these symptoms, this problem, that at the end they finish like psychiatric patients. Common diagnosis doing that. Why happened that? They come in with tablet for depression because the medical science don't understand what happened. And when we don't understand what happened, we say patient is crazy. It's a psychological problem. We're talking regarding this chronic pain. And I said chronic pain exists because we don't understand how to treat it. In prevention, chronic pain is a failure. When patients have chronic pain, that means medical science failed in the treatment. If you at the beginning do prevention, if you at the beginning start to understand what is the problem, nobody will have chronic pain. And we have a specialization in chronic pain. We have a lot of specialties. We treat chronic pain. That's no good. Why happened that? Because each one see one part of the body. Each medical science understand one part of the body and treat one part of the body. And the body, it is not divisible. Medicine normally see that the point, the tip of the iceberg, that is a symptom. The big part of the iceberg is under the water. This is the cause of the problem. And we normally medical science are doing symptomatic treatment. And you will see, we call that in M.P.R. symptomatic treatment is therapy shock. But then we have to treat the patient and we have to resolve the problem. And we have both instruments for the therapy shock and for treatment, real treatment of the patient. Super specialization is necessary, but the super specialists have to have a global vision of the body, an interdisciplinary vision, and holistic vision. Look at that. If I ask you, this is a short arm, everybody say yes, because it looks like a short arm, but the answer is no. If you put 2 cotton rolls into the teeth and say the patient walk 2 or 3 steps and you extend the arms again, the arm is growing. What is that? What is that? This is the negative effect of the mouth and the muscle change. The muscle change. The muscle change, we treat muscle change. And the stomatognatic system is a big disturber of the muscle chain. Look at that. Postural problem, oculomotor system problem, occlusal problem. Where we start? Obviously, if you go to the dentist starts for the teeth. If you go to the oculist, they start for the eyes. And if the patient go to you start for the body, normally. But is that correct? No. Look at that. The same here. Oculomotor system problem, mouse problem, and real short leg. How we treat it? Where we start? And this is a real scoliosis. It's a functional scoliosis. Diagnosis is very important to treat it. And look at this child. That's an occlusal problem that the dentist normally don't see what's happening here with the body. And she or he start to treat the mouth. And then it's creating more problem to the body. Look at that girl, the picture of that girl. Foot support problems, problem here, arm shorter here, mouse problem, and postural problem. And obviously, pediatrics look normally if the weight is good, the height is good, eating well, not eating well, etc., etc., etc. This child, if we don't treat in prevention, she will arrive to us like this. This is another patient with the same exactly problem than the child here, that we can prevent in this age, this problem. Look at that. It's the same picture. And it's 2 different patients. But at the beginning, we don't understand. We don't treat in interdisciplinary that. And the patient will arrive like this 45, 50 years ago with chronic pain, with a lot of problems. Look at that. The patient who is starting to have an oculomotor system here, and she did orthodontic treatment just to make alignment of the teeth. And look at the body, postural assessment, very bad. If we understand all these things, look at that. Look at that guy. Look at that guy. It was an occlusal problem, ocular system problem, and look at this. He started many, many years ago with pain here, and the surgeon said, you have to make an operation here. Because looking the patient through his specialty. After 1 year, pain is coming again. Say, oh, listen, problem is a little bit up. Second operation here. And every 2-3 years, making operations. All colon is blocked. because surgeons look through the eyes of his specialization. Look at here, little girl with functional scoliosis that where is involved mouth, jaw position, and foot support. Obviously, if we do physio here, it will be better. But if we don't take care of annulate this, the scoliosis will come impact. Adult patients, if you see mouth problem, foot problem, and other problems. Look at here, it's a very, very ancient patient with a lot of problem in your mouth, problem in your foot, chronically, and this is much test to see how the muscle change is not working and how is she adapting during the whole life. And now when it's older, when the body cannot compensate, it's very difficult to treat that situation, very, very difficult. Look at that, the same here, patients with different postural problems and occlusal problems. Look at that, the same here, another patient who have occlusal problems, oculomotor system problems, adaptation of the body and scoliosis. And I can show you thousands of patients like this. You can stay here the whole month, study that. Because this is evidence, it's not imagination. And after this great thought, a big conclusion. We only can treat with integration, therapeutic. Integration of this system and the body. We cannot absolutely treat separate. This guy, who is Edmondo Muxi, is an Italian professor. I understand that many, many years ago, he spoke regarding that, 1936, the connection between the position of the body and the posture. That is not new. We forgot it. We leave it in the remember only. This guy, many, many years ago, changed my mind. And I discovered in 1979 this. And I say, wow, what's happening here? What we are doing bad. And then this is Orlando, is my technician who is here now, and listen to me. He presented me this. I don't meet him directly because he died. And I can meet this guy who was a direct student for him. It was a triangle connection. He put the first book in my hand, this orthopedic therapy of the face, 1979, not the teeth, the face. And then I discovered that we can have body balance if we have the exactly balance in mind, structure, and biochemistry. M.P.R, an interdisciplinary protocol, was created many, many years ago to avoid this. Integrated interdisciplinary protocol instrument is M.P.R, myofunctional postural rehabilitation. Why we said integrated protocol? Because it's a protocol who is active, who adapts to the evolution of the patient, is integrated because each specialist interview with the same point of view, and interdisciplinary because various disciplines treat the patient. And what is M.P.R? or myofunctional postural rehabilitation. Why is rehabilitation? Because it's treating the whole systems in posture and physiological. We have a diagnosis in M.P.R. All protocols have a diagnosis. We normally study clinical diagnosis and instrumental diagnosis and supplementary analysis for arrive to a clinical diagnosis of the problem. Clinical, what we study? Oculomotor system, you understand why, because it's involved. We study the postural analysis, different tests, different clinical tests to study the posture. We study the stomatognathing system analysis, just to understand how it's disturbing, and the foot support analysis. Then we do an instrumental diagnosis. We study the posturometry and the stabilometry of the body. We measure. We do scientific the diagnosis, and then supplementary analysis of what? We study alimentation, we study food intolerances, and we study the amino acid deficiencies, because these, if they are working well, they are creating a lot of intoxication of the neuromuscular system. And how we can do a rehabilitation if the muscle is not working. And the M.P.R. philosophy is very simple, very, very simple. It's logical. And I will try to explain all of you in simple words what is this. Normally, we in medical science are like this. Normally, we are like this. Normally, we are like this. This is the I don't see, I don't speak, I don't listen to each other. Imagine today a computer, a modern computer. The brain is the oldest computer in the world. Our central nervous system is working like a computer, exactly like a computer. And it's a very, very perfect computer. Childs who day to day born with a computer, they know very well, very, very well how computer is working. They understand very well that if a hacker infect our computer, we need help because the computer, it doesn't work. We cannot install a new software if the computer is infected by a hacker. We know very well that. And that's why we have an antivirus, yes? To protect the computer, to say, stop, negative things cannot enter in the computer, because if it's not, our software is not working very well. Perhaps the ancient computer we have not antivirus. It cannot be an antivirus in the brain, because if it's not, he stopped to work and we die. And all the information of the proprioception of the body, it will arrive to the computer, to the brain, even if it's not good. And imagine if we arrive a very bad information to the brain, the answer of the computer will be bad. Imagine if we receive from the proprioception of the body, we receive a bad information because proprioceptors are not working well. Or the stomatognatic system is not working. We send the information back, and the computer who is into the head, it doesn't see, but receive the information and say, listen, if something happened, I have to adapt to this situation. And we adapt. And for that reason, one of the reasons was born M.P.R. If you have a headquarter, nobody will think of violating during a headquarter. We stop the headquarter is finished, and then we rebuild the buildings, and we rebuild the buildings with a very good structure anti-seismic. Normally, we stop the aggression first. In medicine, we don't do that. We want to rebuild the systems under the headquarters. That means under the aggressions. When the aggression is stopped, you can plan the reconstruction. That has to be the same in medicine. We have to stop the aggression, and then we plan in the rehabilitation of the treatments. That means we rebuild the body. That's why the protocol of M.P.R is very simple. We have instruments, which is called deprogramming. Deprogramming system is the goal of M.P.R, because with this, we stop the aggression. And then you can do a very good myopostural balance, because we don't have aggressions. And when the body is rebuilt, we can reprogram the things that cannot be reprogrammed alone. Sometimes when we deprogram and we do the rehabilitation, the system themselves, they reprogram it. And we have instruments in M.P.R for the sensory or sensorial deprogramming. For the oculomotor system, and this is common for all medical sciences, the deprogrammation is for everybody to do better their jobs. Oculomotor system, we deprogramming with a very, very small magnetic fields. For the stomatognatic system, we divide in children, and adults. And we have two different specializations. One is orthopedics for the child. But in adults, we have a very, very important instrument for everybody. You can use that. I teach doctors, physios, dentists, all medical science to use body equilibrium device. It's a device that everybody can put in the mouth to annulate the negative effect of the stomatognatic system. Then we have for the foot, common for all disciplines, magnetotherapy and special insults for the programming. Everybody can use that. And then I teach How do the cleaning of the body? How do detoxification of the body? When we do reprogramming of the system, for the oculomotor system, we use exercises, and all my students understand that. They learn how to do that. For the child, we use orthopedics, doing for the dentist, and for adults, this is the dentist who do the reprogrammation of the deprogrammation of the mouth. When we have to reprogramming, we need the dentist. The programming, everybody can do. And for the food support, I teach everybody how to plane different, we call that physiodynamic insult. Everybody can do that. Can do diagnosis and planification of that. And for the biochemistry, some part of the treatment we can do, some part of the treatment we need the doctor to do. All the things we teach our students all around the world, common instruments, common tools for everybody to treat, to do better our job. I don't will teach you how to do a physiotherapy, but I will teach you how to do better the physiotherapy. And then we can teach with our specialists the manual therapies we use normally. After the basis of this, we do masters, and you can understand why we use this manual therapy, not the other. And our professor teaches that in a longer formation. We treated that syndrome, that is an occlusal postural alteration syndrome. Is a common symptomatic. The syndrome is we have sign and symptoms. This is not a disease. Common sign and symptoms. And we do diagnostic classification, depend the part of the body who is altered. The diagnosis, we do a classification, and we do a subclassification when we have subdivisions, when we have psychological problems and biochemistry problems, and then we are making the classification of our patient. With one interdisciplinary protocol that all work together with the same languages, finding the cause of the disease and treating according to the priority. With the diagnosis, you will understand which is the priority to start to the programming. Patients, all ages, can be treated atraumatic. And we develop the natural forces, we develop the natural forces within us that are the true healers of disease. This is hypothesis. Einstein said, if you want different results, do not do the same things. And we said, but do it always in the field of science, M.P.R. Conclusion for today. During growth, we have the change to prevent many future alterations, both postural and stomatognathic system alteration. In the long term, a podalic problem can cause dysphasis problems and vice versa. In these cases, early intervention of the underlying cause is crucial to avoid future alterations. And we use this as is Hippocratic concept, primum not nocere, first don't not damage. And this is a phrase of St. Francis, I was saying, and we are told. He said many years ago, start by doing what is necessary. This is priority. Then do what is possible. This is treatment. And suddenly you are doing the impossible. This is another phrase, is Lucio Annio Seneca. It takes the whole life to learn how to live. And that's very significant phrase. And this is M.P.R. And this is all I try to introduce to all of you in a short presentation. What is the concept of M.P.R? This is the thing. Yeah. Hello, Sayed. Are you still there?
Hello. Yes, it was wonderful, and I am thoroughly listening to your lecture, and it is very informative, and especially it again boosted me when you used the bed first time over here and how it proved miracles over here, and it was really excellent. And your detox therapy with the arnica and the ioniflex and all, and the K bench for the posture, it is extremely incredible. And it is a wonderful thing that we have a lot of physios from India and from Saudi and from Malaysia, and we are really happy to hear you. And at this stage, I will just try to inform all of the listeners that M.P.R Science is going to start up in Kashmir. Most probably in the month of September. We are requesting Dr. Rocca to have a visit to Kashmir, and there he will give a detailed lecture, and on spot he will show the practical sessions. Plus, he will be having. We will get the for further. If anybody wants to join for the courses, they can talk with Dr. Rocca directly over there, and they can enroll themselves. And so that we can plan for the future in Kashmir. And it's really when we, as Dr. Rocca said, it is an integrated approach. It's not a single approach, so it's a broad spectrum, and we can open like a parachute. We will not close ourselves. We will open our brain and reach to each and everything, which will help benefit our patients in general.
This is very important for patients. The M.P.R is a science that help us to use better our tools, because we have tools. No? You are a physiotherapist, no? The people who are listening here, they are physiotherapists. But it's very important to integrate it. And when the best goal of M.P.R is the deprogramming concept. Because that is the thing we will teach in September, no? In Kashmir, the first stage, no? For after that, do the masters if they want, no? The manual therapy. This is after that, the longer formation. But the first thing in September, we teach how to use these instruments, how to integrate that, how to do the diagnosis, everything to be ready to do our manual therapy, because we have different tools in PR. That is manual therapies, special manual therapies, specimen tools for rehabilitation. That will be my professor will teach you, all of you, these techniques. No? But first, we have to understand the concept of M.P.R. No? And when we have these tools, you can deprogramming, you can avoid the aggression to the body, and then you will see the therapies will be long-term therapies. And Sayed, you was very impacted at the beginning, and you believe in that for the beginning, and that's why you want to introduce in Asia. No? It's a very good help for me. No?
That's right.
It's a very
Dr. Rocca, when you implemented this thing on our patients over here, and you implemented, I personally had a hands-on on the concept of M.P.R science. I really felt very different with that. And the bed, I'm still using that, and really it's helping me a lot. And especially the way you diagnose with the mind, interference, and biochemistry, that was excellent.
Yes, it's excellent because you understand the really causes, the cause You know, sometimes in diagnosis, we apply techniques, no, because we are brave, to apply techniques. Everybody who treat the patient, we use techniques. I don't teach you how to do physiotherapy. You know how to do that very well. And I can teach dentists how to do better dentists. But in the physios and osteopaths, and I teach doctors also how to change the point of view of how to see the patient. That's very, very important. And you will have instruments to use, all of you, to use to deprogramming. That's why I put the picture like a headquarter. You see that, Sayed? The headquarter is an aggression of the heart, yes? Nobody wants to rebuild the buildings during the headquarters because they collapse, yes?
Yes, yes.
And we apply techniques because we don't know what is the aggression. Medical science do not understand which aggression we have into the body. That's why deprogramming is a very, very important thing. It's
wonderful. And Dr. De Rocca, if somebody is having any question and all, we will
just... I will open. They can put the hand up if they want to. Let me go to one of them. Okay. Hello, Dr. You can hear me? Yes, I open one microphone. Yes. Can you hear me? It is Rad Khair. Rad Khair, can you hear me? No, it's
hello?
Not the microphone. Hello? Can you hear me? Yeah? You can talk if you like.
Yeah. Yes, I can hear you.
Okay. Do you have any question?
No, I'm waiting to see the approach because it's new to me.
Rad Khair, can you please introduce yourself first?
I'm a physiotherapist from Jordan, studying in Portugal at the moment.
Okay, you are from Jordan.
Yes.
Wonderful.
Okay, wonderful. What is Jordan? Is a good for you to introduce that, and I hope you understand very well the protocol and you understand. This is a new thing. It's a new thing, but slowly we understand that. Today was an introduction. As you see, how is the protocol? The protocol is more than this. This is an introduction. Okay, I'm happy, Jordan. Welcome to our M.P.R. world. Okay.
Absolutely, because we are also planning, Dr. Rad. We are also planning to have one program in Salalah in Oman as well.
It's very close for Jordan.
Yes, but at the moment I'm in Europe. I'm completing my master's degree.
Wonderful. So it's wonderful. We wish you all the very best.
Thank you very much.
Okay, thank you to be here. Thank you. Okay, we open another one. Is Prashant?
Yes, Dr. Purushottam.
Hello, you're there?
Dr. Prashant? Dr. Prashant, you can hear us?
Can you talk? Oh, maybe the microphone is not working. Let me see if I can. No,
okay, Faizan, yes, Faizan, we can open him.
And see Faizan, yes? Can you open?
Yeah, Dr. Faizan. Hello. Dr. Faizan.
Hello, you can hear me?
Yes, yeah, we can hear you.
Yeah, I can hear you.
Yeah, I'm here.
You have any question?
Yeah,
Dr. Faizan, can you first introduce yourself, please, to Dr. De Rocca?
Yes, Dr. Faizan, can you tell us who are you? What is your specialization? Yes.
I can give you his brief introduction. He's a doctor he's a physio in Saudi Arabia. He's working in Saudi Arabia. He's from Kashmir.
Okay.
and he will give the introduction. Just he might. We cannot hear you, Dr. Faizan.
Can you try to talk again? Maybe there is some interferences with the line, you know. Or maybe some interferences with the line. Let me see here. Haisan is another one here.
Oh, Akshay. Akshay. Hello. Hello.
Hello, Hashi. Hello, Hashi.
Hello, Dr. Akshay. Hello, Dr. Akshay. No, we are not able to hear. No, we are not able to hear.
No, he listen to us, but it's not asking, it's not listen the microphone. Okay, I think.
What about Dr. Purushottam?
Dr. Purushottam, what is here? Yes, but I think it's not into the audio here. Do you see here? Some of them are not into the audio because. Let me hear him here.
Hello, Dr. Purushottam.
No, cannot. He cannot speak.
Dr. Faizan? Dr. Faizan is trying to go from, he has joined from another link, I think so.
Yeah, maybe I cannot see here. Here it maybe. Can you see? Faizan? Can you?
Hello, Doctor.
Now?
Yeah, Dr. Faizan. Yeah, we can hear you. Can you please give your introduction? Can you give your introduction, please, first?
My name is Faizan. I'm from basically I'm from India. I'm working as a lecturer in Saudi Arabia.
Okay.
I have done my masters in neurophysiotherapy from Jamia Hamdard in 2004. Since then, I'm teaching.
Yeah.
And mostly I'll be my patients. I go to the hospital. I treat certain patients with various approaches, neurological approaches. But I've never heard of an which you use a holistic approach. Like you consider what I understood so far. You treat the whole body, not a specific part, right?
Yes, it is. Yes, it is. The M.P.R. is. I try to explain you what is M.P.R. exactly. M.P.R. is the concept of interdisciplinary and holistic approach, and then treat the whole body. And all my physios all around the world, my hospitals all around the world, they treat the patients in this way. And it's very easy when you understand today. Maybe something is complicated because it's all new for all of you. But our approach is to integrate the treatment. Do you understand? You never heard something like this before?
Never heard about it before. Okay. This is the first time. I'm very fortunate to hear it from you. Okay. You are very experienced.
It's a good experience to understand that we have new ways to treat our patients. And sometimes we don't understand that we cannot arrive to a deep treatment because we don't have a clinical approach for the whole body. And in the hospital will help a lot to you because in the hospital there is a lot of specialties that can help you also with the treatment. I hope we can introduce that in your hospital. I hope.
Yeah, definitely. Can we treat hemiplegic patients with this approach?
Yes, it is. We treat hemiplegic patients with a different approach, and the treatment
is it a manipulation or something like that?
Yes.
Well, like we give manipulations to the myofascial regions?
Yes, it is.
But how it is going to affect the nerves?
We teach that in the longer teaching, no, not in the basic. No, in the basic, we give you the instruments to do the programming, to diagnose, etc. And then we have, for physiotherapists, a longer master, is 1 year with option for 2 years in manipulation. And in this master we teach, not me, But my physios, my osteopaths, teach how to do that in hemiplegic patients. It's a different techniques we use in M.P.R for them.
Do you have any like specific technique which is very effective in case of acute hemiplegia?
There is not only one. We have techniques, different techniques. We use acupuncture. We use different techniques, different manual therapies, myofascial therapies. We use stretching. We use different techniques. There is not one technique for all patients. We teach the techniques, and then you can choose the best one for the specific patient. You understand?
Yeah, I got it. Like, yeah, like you try to correct the posture, and which is going to affect the movement.
Yes, it is. And then we use treating the biochemistry, treating the detoxification, treating the muscle change with different techniques of manipulation. They help a lot of hemiplegic patients. A lot. M.P.R help a lot. There is a formation. This is not in 2 days. This is not a formation you can be formatting.
Yeah, I understand, because it is a whole course. I cannot understand everything in 1 day or in one lecture. You can give me an overview of it, but I fully understand that you will not be able to tell me all the details.
Yes.
That's why, Dr. Fazdan, that's why we are requesting Dr. Rocca to come to Kashmir, so that he can, especially for the northern side of India, they will come to know about the modern science of M.P.R. I have personally, I am treating a hemiplegic case over here in Oman. Dr. Rocca has visited him, and we tried a lot for him on the K bench, which is a posture bench. He will introduce it as well, and he will tell more about that, the K bench and all. And plus the bed, because of the poor denture of our patient, we couldn't place the bed to him, the body equilibrium device. And we are using still, we can discuss, I will just later tell you the things what we are doing in that cases as well. But with respect to M.P.R science, we have taken Ioniflex, he has introduced Ioniflex with arnica to our patient, and the K bench for his posture, which helped him a lot with respect to his body posture and all.
And it's very important to understand that hemiplegic patients have a very big problem in muscle change, because it doesn't receive for the brain the exactly input to work. And it's patients who need more M.P.R, because with M.P.R you do potentialization of the muscle change. And it's a concept that at the beginning, in Kashmir, the thing we want to do is introduce all of physio in the concept of M.P.R. And then there we will start the master for 1 year, just to teach in our school the techniques and the manipulations, different things, different techniques that you can use in patients with ictus. Yeah.
That's wonderful. That's wonderful. Okay. You know, I'm always ready to learn new things.
Okay. And then I hope you can stay with us in Kashmir in September. Okay.
Surely. He is a part and parcel.
Okay.
Thanks a lot, Dr.
I will meet you in September, all of you in September in Kashmir. We will be in touch by mail with Syed, contact. We will be in touch to introduce that concept in all Middle East. Okay?
When are you coming to India?
September.
In September. Actually, I'm going to India in June, and I'm returning back on 24th of August.
Okay. We will be there.
So still, Dr. Fazdan, We are yet to decide the perfect date. Let us take the consent of others as well. Even I myself might be in June until July in Kashmir. So let us see Dr. Rocca's schedule as well, and we will just see others' schedule as well, and then we will decide accordingly.
Yeah, definitely, definitely.
That will be perfect.
It will be my proud privilege to talk to a legend.
Yeah, Dr. Rocca is a very humble and a very good human being.
Thank you
Yeah,
so
it
much,
seems because from his talking.
Yeah, he is
Very humbling and very polite.
And I believe that we are only instruments of God with our patients. We do the best to communicate the God experience to our patients. We have to open our brain and our heart and our hands work, not for ourselves. It's someone out of us to guide us, and then that's why I'm very happy to go to a place like India and Kashmir to go to teach all of you. Okay.
Yeah, definitely. I have opened my parachute.
Okay. Open the parachute. You have to open the parachute. Okay. I think we leave these guys to go to sleep. What do you think? Because
yeah.
It's a long time to you there. It's more than 3-4 hours.
How is Orlando? His cap is still lying with me because when I was about to come to Italy because of the visa issue, I couldn't come to attend the K-bench and the training. His cap is still with me.
Orlando is here. I don't know if he can talk with us. Orlando, you can talk in English or not? Can speak
Hola, Prof.
English?
Lido English perché il mio cerebro è stato invaso dall'ispanico e quindi ho perdido un poquito di inglese. Ma
I translate for you. Orlando is teaching with us in a master in Spanish now, no? Sayed, and you see, I lose the English for the Spanish.
I'm very happy to listen the voice of Sayed for the first time.
Yes, Orlando, I am really obliged to hear your voice as well. And your cap is still with me. Omani cap is still with me.
Okay. Here we have another person here who is Graciela.
Yes.
Graciela is from Argentina. I don't know if he has speak open now. Hello, Graciela, ¿cómo estás? ¿Cómo te va? ¿Me estás escuchando? Hola.
Hola, doctor.
Hola, ¿cómo? A ver, háblale un poco en inglés a Sayed.
No.
Hello, Graciela. How are you?
Graciela is my director of the school in Argentina.
Oh,
He's director of our school in Argentina.
My privilege to talk to Graciela. How are you?
Okay. ¿Cómo estás, Graciela? Te dice Sayed. Sayed es un
Tengo que aflojar la lengua, por eso lo estoy escuchando.
Okay.
Los entiendo, pero me cuesta hablar.
She is saying, I will learn English just to talk with you in English for the next time, okay?
Surely.
As you see, this is an international school because Orlando is from Italia, and that is the magic thing from the technology. We can talk with different languages, with different parts of the world in the same time. This is M.P.R.
And also, Dr. Rocca, Dr. Faizan has put a very good thing regarding the hemiplegia and the M.P.R. science. If you remember, when you came over here, I was talking about having a research, a thorough research with respect to M.P.R. science with stroke patients. If you remember.
Yes, I remember. Yes, I remember perfectly. Yes.
I will get in touch with Dr. Faizan as well, and we will see some more who are with us in the team today. And with your support and your guidance, we will just start up research on hemiplegia and M.P.R. science.
Yes,
stroke and M.P.R. science.
This is the thing we do all around the world. We are
Yes.
developing research in different fields. That will be very good to do with all of you a research in the field of hemiplegia. That will be very good. I have it in Cuba also. We are doing
Yes.
with the University of Cuba. We are doing research also of M.P.R. in different parts of the world. We are develop different researches. And that will be a pleasure for me to do that with you in Kashmir and Middle East to stimulate the people to do research in M.P.R. science. Okay?
Wonderful. I will come to you. We will talk out of the group, inshallah.
Okay. Take care, everybody.
You take care. Okay.
Take
Bye-bye.
care, and thank you so much to be here, everybody. Thank you so much.
Thanks a lot for your special lectures, and it was really wonderful and informative. And we thank you for everything. Thank you, Dr. De Rocca, and we will look forward to see you in Kashmir very soon.
Okay, soon you will see you la. Okay. Take care. Take care, everybody. God bless you, everyone, and then we'll be in touch for the student to study in the future. Take care. Bye bye.